The purpose of outbreak investigation is to rapidly identify and control the spread of disease. The primary goal of an outbreak investigation is to identify three critical factors: the cause, the source, and the mode of transmission of the disease. This process is based on the epidemiological triangle, which illustrates the relationship between the disease agent, the host, and the environment. First, investigators must identify the cause. What pathogen or agent is responsible for the outbreak? This requires collecting specimens and conducting laboratory testing to confirm the diagnosis. Second, investigators need to identify the source of the outbreak, where it originated. This involves tracing back to the initial exposure and pinpointing the geographical or physical point of origin. Contact tracing, as shown in this COVID-19 example, is one method used to identify potential sources and track how the disease spreads from person to person. Third, investigators must identify the mode of transmission, how the disease spreads from one person to another. This is crucial for implementing effective control measures. Diseases can spread through various routes, including airborne transmission, direct contact, vector-borne, or fecal-oral routes, among others. Once investigators understand the cause, source, and transmission mode, they can implement targeted control measures to stop the outbreak's spread. These control measures may include isolating infected individuals, quarantining exposed contacts, implementing environmental controls, and launching vaccination campaigns when appropriate. In summary, the purpose of outbreak investigation is to provide the essential information needed to protect public health through rapid, targeted interventions that prevent further spread of disease. By understanding the cause, source, and mode of transmission, public health officials can effectively contain outbreaks and save lives. In outbreak investigation, time is the most critical factor. Delays in response can lead to devastating consequences. Each day of delay can increase the severity of an outbreak, resulting in more patients requiring emergency care. However, rapid investigation and response offer significant benefits. Effective outbreak response requires coordination across multiple teams working together in real time. Early detection and rapid response can dramatically reduce the size and duration of an outbreak. The data is clear. Delays of just 1 week can result in 2 to 3 times more cases, while rapid response can reduce deaths by 30 to 70%. For every day saved in the investigation process, hundreds of lives can be protected and communities preserved. Outbreak investigations require a multidisciplinary team of experts working together. These professionals bring different skills and expertise to identify, contain, and control disease outbreaks. Let's meet the key members of an outbreak investigation team. The field epidemiologist conducts on-site investigations, collecting data directly from affected communities. Laboratory scientists perform crucial tests to confirm diagnoses and identify the specific pathogens causing the outbreak. Data managers process and analyze information to track patterns and help the team understand the outbreak's dynamics. Environmental health officers investigate surroundings to identify factors that may be contributing to the spread of disease. Risk communication specialists ensure clear transmission of findings and recommendations to the public and stakeholders. Logistics coordinators manage resources, ensuring the team has the supplies and equipment needed for an effective response. Successful outbreak investigation requires seamless collaboration across these disciplines, with each role contributing unique expertise to the team effort. Together, these professionals form the core response team that works to identify, contain, and ultimately stop outbreaks to protect public health. The data manager is a crucial member of the outbreak investigation team, responsible for the collection, management, and analysis of outbreak data. Data managers have several key responsibilities throughout an outbreak investigation. They manage the entire data workflow, from initial collection to final reporting, ensuring information flows efficiently throughout the investigation. Data managers create vital visualizations like epidemic curves and geographic distribution maps to track outbreaks and identify patterns. To perform these tasks effectively, data managers use specialized technology and tools, including mobile data collection apps for fieldwork. The data manager integrates with all aspects of public health response, providing critical information that guides the investigation and evaluation of interventions. The logistics coordinator is a vital member of the outbreak investigation team. They ensure the investigation team has all necessary resources to effectively conduct their work during outbreak response. The logistics coordinator has several key responsibilities essential for successful outbreak investigations. First, they manage the supply chain, ensuring access to medical supplies, laboratory materials, and personal protective equipment. They're also responsible for equipment management, maintaining and distributing testing instruments, mobile laboratories, and surveillance tools. Communication systems are critical during outbreaks. The coordinator ensures teams have reliable field radios, satellite phones, and internet connectivity. Process management is another key responsibility. This includes coordinating transportation, setting up field sites, and allocating resources efficiently. Logistics coordinators also develop contingency plans for different outbreak scenarios, ensuring rapid resource mobilization and emergency response protocols. The logistics coordinator plays a critical role in outbreak investigation by enabling rapid deployment of teams, maintaining continuous field operations, connecting all members of the response team, and supporting adaptation to evolving outbreak conditions. The risk communication specialist plays a crucial role during public health emergencies. These specialists develop strategic communication plans that translate complex scientific information into clear guidance for different audiences. These specialists tailor their messages for different audiences, including the general public, healthcare providers, government officials, and media outlets. Risk communication specialists follow key principles to effectively translate complex health risks into actionable information that the public can understand and use to protect themselves. During outbreaks, effective communication helps provide accurate information, reduce public fear, counter misinformation, and build trust in public health authorities. The risk communication specialist is a vital member of the outbreak investigation team, essential for maintaining public trust and encouraging compliance with health recommendations. Step 2 of outbreak investigation focuses on defining and identifying cases. A case definition is a standardized set of criteria used to decide which individuals should be counted as cases of the disease under investigation. Every case definition contains 4 key components: person, place, time, and clinical criteria. These components help investigators categorize and track outbreak cases systematically. The person component identifies who is affected, including demographic factors like age, sex, or occupation. Place defines the geographic boundaries of the investigation. Time establishes when cases occurred, and clinical criteria specify symptoms and laboratory findings. To standardize case counting, public health officials classify cases into 3 categories. The classification system helps organize our understanding of the outbreak. This reference chart shows how infectious diseases are classified, which helps when developing specific case definitions for an outbreak. Cases are typically classified as suspected, probable, or confirmed based on the strength of evidence. A suspected case meets the clinical criteria but lacks confirmatory evidence. A probable case has both clinical criteria and epidemiological links, or some laboratory evidence. A confirmed case has definitive laboratory confirmation, providing the highest level of certainty. To organize case information, epidemiologists create a line list, a table where each row represents an individual case and columns contain key variables. Here we can see a COVID-19 surveillance form used to collect standardized data on cases. On the right is a simplified line list with columns for ID, demographics, exposure information, clinical data, and case status. For more complex outbreaks, extended data collection forms may be used to gather additional details on each case, as shown in this example. These detailed forms help investigators track contacts, identify potential exposure sources, and monitor the progression of cases over time. In summary, defining and identifying cases through standardized criteria is a crucial second step in outbreak investigation. It establishes a common language for the investigation team and ensures consistency in data collection and analysis. With a clear case definition and organized line list in place, investigators can move to the next step, describing the outbreak data by time, place, and person. Step 4 in outbreak investigation is to develop and test hypotheses about the source, mode of transmission, and risk factors. After collecting and describing initial data by time, place, and person, investigators can begin to formulate hypotheses about what might be causing the outbreak. The epidemiological triangle is a fundamental framework that guides hypothesis development. It considers the relationship between the host, the agent, and the environment. Using this framework, investigators formulate specific hypotheses about what might be causing the outbreak. These could include contaminated food or water, person-to-person transmission, or environmental exposures. After developing hypotheses, investigators must test them using various epidemiological methods. These include both observational and experimental approaches. The testing process involves comparing case exposures to expected rates, calculating measures of association, and evaluating statistical significance. Investigators also assess whether findings are consistent with known facts and biologically plausible. Statistical measures like risk ratios help quantify associations between exposures and disease. A risk ratio greater than 1 suggests that the exposure increases the risk of disease, supporting the hypothesis. The results of hypothesis testing guide the next steps of the investigation and help determine which control measures should be implemented to stop the outbreak. Step 5 of an outbreak investigation is to conduct analytic studies. Analytic studies evaluate hypotheses about associations between exposures and disease outcomes to determine causality. The two main types of analytic studies used in outbreak investigations are cohort studies and case control studies. This comparison shows the key differences between cohort and case control studies. Cohort studies follow exposed and unexposed groups forward to see who develops the disease, while case control studies start with disease cases and controls, then look backward to determine exposures. Case control studies are frequently used in outbreak investigations because they are more efficient when the disease is rare. They provide odds ratios rather than relative risk. In a case control study, we start at the present with groups of cases and controls, then look backward to determine who was exposed to potential risk factors in the past. Cohort studies follow groups forward from exposure to outcome. They provide relative risk calculations and generally offer stronger evidence for causality. This example shows how to calculate relative risk in a cohort study. In this case, the relative risk of 1.38 means that smokers have a 38% higher risk of developing coronary heart disease compared to non-smokers. Exposure assessment is critical for accurate analysis in both study types. It involves characterizing the exposure setting, identifying exposure pathways, and quantifying the exposure. This diagram illustrates the process of exposure assessment, from characterizing the exposure setting to identifying exposure pathways to ultimately quantifying the exposure. When conducting statistical analysis of epidemiological data, there are several important considerations. These include ensuring proper data generalization, being aware of potential biases, and not ignoring anomalies in the data. To summarize, analytic studies establish the strength of association between exposures and disease. The choice of study design depends on the specific characteristics of the outbreak. It's essential to control for confounding factors and interpret results with statistical rigor. Step 6 of outbreak investigation involves interpreting laboratory and environmental findings. Proper specimen collection and handling are essential first steps. The quality of specimens directly impacts laboratory results. Proper storage prevents deterioration, and chain of custody must be maintained throughout the process. Laboratory analysis employs several methods to identify and characterize the causative agent. These include culture and isolation, serological testing, molecular methods like PCR, and advanced genomic sequencing. Environmental investigations complement laboratory findings by examining potential sources in the environment. These include water and soil sampling, food testing in foodborne outbreaks, air quality assessment, vector surveillance, and facility inspections. The key to successful outbreak investigation is integration of laboratory, environmental, and epidemiological data. This unified approach allows investigators to identify the source and mode of transmission with greater confidence. Let's look at an example of a foodborne outbreak investigation. In an E. coli outbreak at a summer camp, laboratory analysis isolated E. coli O157H7 from patients, and the same strain was found in leftover hamburger meat. Environmental investigation revealed improper cooking temperature in the camp kitchen and cross-contamination between raw and cooked food. The integration of these findings conclusively identified undercooked hamburgers as the outbreak source. Global disease outbreaks are occurring with greater frequency than ever before, posing significant challenges to public health systems worldwide. This map shows the distribution of recent outbreaks across the globe, reflecting the increasing interconnectedness of our world. Globalization is a major driver of this trend. Increased international travel and trade facilitate the rapid spread of pathogens across borders. Urbanization creates dense population centers where diseases can spread more easily. This map shows high-density urban areas in Africa that are particularly vulnerable. Climate change is expanding the geographic range of disease vectors like mosquitoes. This visualization shows increased months of mosquito survival due to warming temperatures. Zoonotic spillover events, where diseases jump from animals to humans, account for approximately 70% of emerging infectious diseases. Habitat disruption increases contact between wildlife and human populations. With these factors converging, we can expect the frequency of outbreaks to continue increasing in the coming decades. Preparedness is therefore essential. Effective preparedness requires collaborative surveillance, community protection, access to medical countermeasures, and robust clinical care systems, all coordinated through emergency response mechanisms. The data is clear. Since 1980, we've seen a 300% increase in epidemic events worldwide. Being prepared is no longer optional, it's essential. Effective outbreak response requires collaboration across multiple disciplines and expertise areas. Interdisciplinary response teams are designed to address outbreaks through coordinated efforts from various specialists. These teams prepare for, respond to, and establish best practices for handling disease outbreaks. Several key disciplines work together during outbreak investigations. These include epidemiologists, laboratory scientists, environmental health officers, data managers, logistics coordinators, and communication specialists. Effective collaboration requires a clear organizational structure. This ensures that both coordination and command functions are well defined during an outbreak response, allowing teams to work together efficiently. Collaboration extends to fieldwork, where professionals from different disciplines collect and analyze environmental samples. This requires coordination between field workers, laboratory scientists, and data analysts to ensure proper sampling, testing, and interpretation of results. Communication planning during outbreaks requires input from multiple disciplines. Teams collaborate to develop appropriate messages for different stages of an outbreak, considering scientific accuracy, cultural sensitivity, and public health needs. Interdisciplinary collaboration offers several critical benefits during outbreak response. It enables comprehensive analysis by combining multiple perspectives. It accelerates response time when specialists work together, and it optimizes limited resources by sharing expertise across disciplines. Despite its benefits, interdisciplinary collaboration faces challenges. These include different terminologies across disciplines, varied priorities and approaches, and communication barriers in high-pressure situations. These challenges can be overcome through joint training, regular coordination meetings, standardized protocols, and fostering mutual respect among team members. In summary, the The success of outbreak investigation and management fundamentally depends on effective collaboration across diverse disciplines, each bringing valuable expertise to the collective response. Ethical considerations play a crucial role in guiding outbreak response efforts. When public health teams respond to outbreaks, they follow ethical frameworks to guide their decision-making process. During outbreak responses, three key ethical areas require careful consideration. First, resource allocation involves making difficult decisions about distributing limited medical supplies, personnel, and treatment options. Second, quarantine measures must balance public safety with individual rights and freedoms. Third, the use of experimental therapies raises questions about consent, risk, and scientific integrity. When resources are limited during an outbreak, medical teams must make difficult decisions about who receives care first. Ethical resource allocation is guided by principles of fairness, maximizing benefits, and protecting vulnerable populations. Quarantine measures are often necessary to contain outbreaks, but they raise important ethical questions about limiting individual freedom for public health benefit. Ethical quarantine policies use the least restrictive means necessary, ensure transparent communication, and provide support for affected individuals. During outbreaks, there's often pressure to use experimental therapies before they complete standard testing procedures. Ethical frameworks for experimental therapies emphasize informed consent, fair participant selection, careful risk assessment, and rigorous oversight. To navigate these complex ethical issues, public health teams rely on structured decision-making processes that engage stakeholders and consider multiple perspectives. Ethics committees play a vital role in guiding these difficult decisions, balancing community needs with individual rights, and ensuring transparent processes that build public trust. Strengthening public health systems requires adequate resources for effective outbreak detection and response. A strong public health system relies on four essential resources: human capital, laboratory capacity, logistical support, and robust surveillance systems. Human capital is at the core of any public health response. This includes skilled epidemiologists, field investigators, data analysts, and community health workers who are trained to detect and respond to outbreaks. Laboratory capacity is critical for accurate diagnosis and surveillance. This includes modern testing facilities, diagnostic equipment, trained staff, and quality control systems to ensure reliable results. Effective logistical support ensures that necessary supplies and equipment reach responders when and where they're needed. This includes supply chain management, emergency response equipment, transportation networks, and resource allocation systems. Robust surveillance systems provide early detection of potential outbreaks. This includes real-time data collection, early warning systems, advanced analysis tools, and cross-border information sharing mechanisms. Building public health capacity requires sustained investment in infrastructure, workforce development programs, public-private partnerships, and international collaboration. Strong public health systems save lives by enabling rapid detection and effective response to outbreaks. Investment in these systems is not just a cost, but a crucial safeguard for global health security.